Sessions. My name is Mark Priestley and I'll be chairing this session. So we have three of the early stage researchers who are going to summarize some of their emerging findings, and we have three respondents who will be with us. Ruth is going to join us. Rosemary is online, hopefully. Is Rosemary online? Okay. Hopefully Rosemary will be online. Maybe someone wants to email her or something. Welcome, Ruth. And we'll start straight away. So we have a maximum of 30 minutes to kind of engage with each piece. So I think what we're asking the early stage researchers to do is to take kind of 10 minutes, as close as you can get, and roughly the maximum for the same for the respondent. It's okay to be shorter. And then we have some minutes for expansion or discussion. Good. So welcome to Colin, who's going to be the guinea pig, first to try the process. So I'm going to hand straight over to you, Colin. Introduce yourself and give us your findings.
Thanks very much. I'm Colin Kaki and my PhD at the Centre for Disability Law and Policy at NUI Galway. And in my PhD, I explore the relationship between national human rights institutions and disabled people's organisations. And what I'm trying to do is consider the role that a national human rights institution can play in strengthening the voice of disabled people and their organisations. And for anyone who's not familiar, national human rights institutions are statutory bodies that are independent of the state, who have been accredited as being independent by a UN-backed system. So when the UN CRPD was being negotiated, it was considered that national human rights institutions could play a key role in correcting the historic exclusion of disabled people from the policy-making process. And in their seminal report, which informed the development of the UN CRPD, Professor Teresa Degner and Professor Gerard Quinn, they set out a range of ways, 4 ways in particular, that they considered that national human rights institutions could potentially support national disabled people's movements. And in my research, which involved analysis of international promising practices amongst NHRIs and case study analysis of the Equality and Human Rights Commission in the UK and the Irish Human Rights and Equality Commission, I tested these 4 propositions that are set out in the slide there, the top 4 bullet points. And I'm just going to go through each of those now and highlight a couple of the key findings that have emerged from my research. So in terms of supporting disabled people's organizations to build human rights capacities, I find some discrete examples of NHRIs delivering quite innovative training programs to disabled people's organizations. But in general, NHRIs considered that it wasn't really their role to be capacity building bodies, that they weren't really a source of formal training programs for DPOs. So NHRIs tend to emphasize that they hadn't been resourced to provide these programs that, as Gerard Quinn said in his presentation this morning, that sort of policy entrepreneurial skills that DPOs and disabled people need to bring about the changes required to bring about compliance with the CRPD, that they weren't resourced to provide those training and capacity building programs. And given that NHRIs weren't performing that role, I inquired whether they were monitoring, whether there was other bodies in society, in their jurisdictions that were providing this training. I was quite surprised that NHRIs hadn't critically assessed the availability of funding and training programs to DPOs to enable them to engage in policy discourse in their jurisdictions. So it sort of begged the question for me that if the national human rights institution is not doing it, who is there really to monitor how DPOs develop their skills to speak out on human rights? How do they gain that knowledge and expertise? More positively, I did find that through their monitoring activities, national human rights institutions were providing informal learning opportunities in which disabled people in their organizations were able to glean insight into both domestic processes and to the human rights system from the National Human Rights Institution. In particular, NHRIs had established advisory bodies that included disabled people and their organizations. Those forums, although they're established really to assist the NHRI, the individuals involved within them really develop their own expertise and develop their capacity to engage in human rights-based discourse. Then in terms of validating the claims of disabled people, I find that DPOs and disabled people often bring concerns to national human rights institutions in the hope that the NHRI will conduct an inquiry or an investigation. And through their inquiries, national human rights institutions can shine a light on abusive practices that may not be captured by more official channels. They also can develop, and some NHRIs have developed, participative approaches such as oral hearings, whereby disabled people are given a platform to share their lived experience and to raise the public discourse on important issues, particularly around institutionalization. But one thing I encountered in particular, the circumstances in England and Wales, where quite often the DPOs have brought an issue that they would like to be investigated, and the National Human Rights Institution has for numerous reasons decided not to undertake one. But that's created a bit of conflict between the EHRC and disabled people's organizations. So it's important in designing their approach towards inquiries and investigations that national human rights institutions have open processes and clear decision-making approaches. I find that NHRIs have collaborated very effectively with DPOs in developing shadow reports to the CRPD committee. And NHRIs are also in a process with support from the OHCHR of developing quite sophisticated tracking tools and websites whereby they're monitoring the implementation of treaty body recommendations, including from the CRPD committee. And I think these tools will take on increasing prominence due to the significant delays at the treaty body system that have only been made worse due to the coronavirus pandemic. But one slight concern I had was that NHRIs tend to focus support for DPOs on engagement with the CRPD committee. And there's a lack of evidence of NHRIs supporting DPOs to engage in the other treaty body processes or UN processes. And this is something that needs to be addressed to ensure that disability rights are mainstream throughout the UN system. And on a third point, in this morning's presentation, Professor Quinn really emphasized the importance of system change as a way of bringing about CRPD compliance. And national human rights institutions, as statutory bodies with a responsibility to provide advice, can play a key role in advocating for reform of policymaking processes to ensure they're inclusive of disabled people's organizations. In both of my case studies, the state had developed new participative structures for engaging with disabled people. But in both jurisdictions, DPOs had concerns that these were not meaningful or truly participative. DPOs in particular considered that these initiatives failed to appropriately prioritize the views of disabled people's organizations over service providers. And this is an area where I think NHRIs need to do more and need to consider the ways in which priority can be given to the views of disabled people in practice. And then in terms of addressing violations, I find that national human rights institutions have supported disabled people and DPOs in some important legal cases. In the UK, there have been cases in relation to eligibility for juror service for deaf people. And there's also been quite important legal precedents developed, both by strategic litigation initiated by the EHRC and by interventions that they have carried out. But I think it's important not to overstate the ability of a national human rights institution to meet the legal needs of disabled people. And national human rights institutions can potentially have a much greater impact through utilizing their regulatory powers and promoting the embedding of human rights and equality duties in the public sector. And I think the work of the Irish Human Rights and Equality Commission in embedding the human rights and equality duty that's enshrined in law there is a real good example of best practice in terms of changing ways of thinking within the public sector there. So just in concluding, in my research, I've found a mixed picture. There's promising practices emerging, but there's a need for NHRIs to be more purposeful in considering how through their activities they can support disabled people's organizations to act as key agents of change. And I think there's a need for networks of national human rights institutions like the European network of NHRIs to consider how NHRIs can really embed the principle of nothing about us without us in how they go about their work as independent monitoring mechanisms. So that's the end of my presentation, and thanks very much for listening.
Beautifully done in 9 minutes. You've gained a question. Excellent. So it's a real pleasure to welcome Ekaterina, who is the Deputy Public Defender in Georgia and chair of the European Network on National Human Rights Institutes working group on the CRPD. I can't think of a better respondent to have for this particular topic. So thank you.
Thank you very much. First of all, I would like to thank you for inviting me and for our network to be part of this amazing conference. And thank you very much for such an interesting presentation of the findings of your research. We had a small chat before we started our session, and I said that I really completely agree all findings you have in your research, and all the problems identified are the concerning issues for us, for NHRIs working in this field. First problem I want to name is lack of financial resources. And I totally agree that sometimes NHRIs are designed to be monitoring body of CRPD convention without allocating enough and sufficient resources to do so. So during the pandemic, it was already also very clear for us that some budget cuts, which are like many NHRIs are facing budget cut problems in many countries. So this is affecting our work in this field. Although it's not a case in Georgia, but we all know in our network, and I'm lucky enough to have a cooperation and communication with other NHRIs, that lack of sufficient resources is one of the biggest problem in our work. So another problem is institutional capacity and human resources of NHRIs. Sometimes NHRIs have a very broad mandate to work in all human rights, and the rights of persons with disabilities and working in this field is somehow hidden in all the activities they are doing. And namely in countries with some political crisis like Georgia, Moldova, for example, Ukraine now, we are facing a lot of challenges in the human rights field, like ongoing conflicts, or I don't know, financial crisis or economical crisis. And somehow working on the rights of persons with disabilities are hidden in all other activities. So the most important issue I wanted to add to Colin's research is, like to Colin's ideas, is to have a clear picture where this stands in our institutions. Do we have structural units working on the rights of persons with disabilities? Do we have consultative councils, or do we have a participation policies, how persons with disabilities are part of our activities and our work, not to have it hidden in our general activities we are conducting or doing. And third issue we are facing and very problematic in our work is that we do not have very clear guidelines or comprehensive guidelines about the participation of persons with disabilities into our work. Of course, we have CRPD General Comment 7, which give us a broad picture or basic standards how persons with disabilities or organizations working in this field can be part of decision making or some participatory processes. But at a national level, sometimes we do not really have a clear standards or guidelines how we can do it in practice. So I can also name this problem as a really urgent in our work to have a very concrete steps or some examples how we can do it in practice and how it should be effective. For example, in Georgia, in our NHRI, we have consultative council, which is providing recommendations and some guidance to our office how we can work, how we can conduct monitoring activities, or which are the priorities for the community this year or next year. But without really clear vision or without really clear guidelines how we are inviting them, how they are part of our work, is really difficult to achieve some tangible results in this field. I cannot really completely agree in one point, but I'm sure that it's a case of those NHRIs. We have some limitations in your research that it was just 2 NHRIs analyzed in this field. It's about NHRIs not comprehensively working to other dimensions like awareness raising activities or research activities or like involvement of DPOs in this process. So we have many good examples around Europe, as I'm talking on behalf of this European network, that NHRIs are conducting a lot of awareness raising activities in this field with participation of DPOs and the persons with disabilities, also like informational campaigns I named, but also other educational activities in this field or conducting researches in this field. But of course, it can be a problem in many NHRI's work. What I wanted to suggest, like in a recommendation part, is first issue is importance of exchange best practices among NHRIs is very crucial and very important, because we all have different practices. We all have different country situation or background information in our countries, but still we can find a lot of similarities and a lot of good practices, or like we can get some answers about the challenges we are facing at national level if we will have very good cooperation at international level. So I want to underline the role of GANRI, Global Alliance of National Human Rights Institutions, and ENRI, European Network, but still maybe there is need to be done more and to have more frequent exchange of experience among NHRIs and build on our experiences, like some good practices. Also, what I wanted to say is clear guidelines for NHRIs, how we can involve or how we can ensure the meaningful participation of persons with disabilities and DPOs into our work. So it could be also recommendation towards OHCHR, who is really helping in this field, or like to help NHRIs in this process. And last point is our financial problems are not only our problems, it's a state problem. So I think that CRPD committee should somehow ensure the let's say advocacy or some pressure to the governments to allocate enough and sufficient resources for NHRIs. And it was also in the research presentation that proper monitoring of Article 33 is really crucial and important. So maybe we can also advocate to create some special working group or some special task at the CRPD committee level to monitor how the states are implementing their obligation to provide sufficient resources for implementation of CRPD convention. So this was all from my side, and thank you very much once again.
Perfect. Thank you. There's a really interesting range of issues there, particularly about the role of national human rights institutes. What are they, and how do they exist in relation to disability? Is disability a minority concern? Is it a specific concern? How can that be targeted? The monitoring of convention implementation, and what role does to what extent is a human rights institute allied with the state, or perceived to be, from disabled people's perspective, as it is independent. But is it independent of the state? Is it independent of disabled people's advocacy? And how does that triangle of advocacy work? So, because our speakers were so well timed, we have time for questions, which is fantastic. So I think questions or contributions or discussion, and we'll do that for a little bit less than 10 minutes. Teresa.
Hi, thank you for your input, both Colin and Ekaterine, for your inputs. It was very interesting to listen to, and I think, Colin, you have made very important findings, the research we really need in order to foster the implementation of the CRPD at the practical level. My question is more of a cultural nature, maybe. What is your, both of you, what is your assessment as regard of whether or not NHRIs appreciate that due to the CRPD, their own status has raised considerably? According to my understanding, the CRPD is the only UN treaty body which really gives a lot of legal mandate to national human rights institutes, and that should also make the NHRIs a natural ally of the CRPD. Is that something which is still prevailing, or is it withering away with now the CRPD being in force for more than 10 years? That's one question I have. And the other is more of practical nature. How accessible are NHRIs to disabled people? Is there a mapping tool for that? Or is there a guideline for NHRIs on how to make themselves accessible to disabled people? Thank you.
Yeah, let's maybe just take that first, and we'll allow Colin to respond first.
Yeah, in terms of NHRIs appreciating the importance of their role as an independent monitoring mechanism, I think certainly for looking at my two case studies, so the Equality and Human Rights Commission was designated as the independent monitoring mechanism without really any critical assessment of its legal basis for doing that, or really additional resources provided to them. And obviously that's not an example of good practice. The Irish Human Rights and Equality Commission, in contrast, there's been quite a bit of discussion, and it's going to be provided for in legislation, that their new role as an independent monitoring mechanism, and there's an anticipation of some additional funds. So I think actually it's an improving position in terms of NHRIs taking on that role as an independent mechanism. And I think NHRIs now are appreciating what the role actually involves and the resources that they need to carry it out effectively. So hopefully that will lead to more NHRIs, advocating for additional resources, even those that have been designated previously. And what I would like to see actually is NHRIs reflecting on the composition of their own institutions and the ways that they're engaging with disabled people. So we've seen some NHRIs developing new mechanisms for engaging with disabled people's organizations. And then on the second question about how accessible NHRIs are, there's a bit of a discussion within NHRIs as to whether it's best to mainstream disability issues throughout the NHRI, or it's best to have specific disability units or specific disability commissioners. And that's been a debate, again, that the EHRC have had. And from my evidence, it seems that disabled people very much prefer there to be a disability unit or a specific entry point that they have into the system, almost like a focal point within an NHRI. And I think there needs to be a bit more reflection as to what the best approach there is. And that could maybe be set down in some of the guidelines that we were discussing, that NHRIs could definitely develop their capacity to be more accessible, and should be looking to designate specific officers, I think, to be responsible for facilitating that participation in their decision making.
So I'll just add a few sentences about legal mandates of NHRIs, and we can see that there are two types of NHRIs. First, legally identified to be a monitoring body of CRPD convention, or just self-identified to be a monitoring body of CRPD convention. For example, in Georgia, we do not have any article or anything in our legislation which defines that Public Defender of Georgia is monitoring body of CRPD convention. It was part of some meetings, governmental meetings, that it was said that Public Defender could be the best institution to do so, and we are doing it. So we are self-identified monitoring bodies. So of course, it is really problematic in practice, because we need sufficient resources to do all activities and etc. So we can see two different models around Europe of NHRIs. And about accessibility, I had in my notes, unfortunately, I forgot to mention, this is also a huge problem. If our buildings or information we are providing is accessible for the persons with disabilities, and I will share one bad example from my practice. Our office, when we are trying to find a hotel or like a conference room to conduct trainings or conferences, we are always asking to have accessibility issues in place. And we've been criticized by the state audit office why we are asking like accessible places if we are not inviting persons with disabilities, because these kind of places cost much, like it's the money is more needed, because in Georgia we have this problem, and if hotel is accessible for the persons with disabilities, it's the price is higher. So we've been criticized for this, but still we are doing this practice, we are following this practice, because we don't know in each and every meeting if the persons with disabilities will join or not. So we have to be ready for this. So it's a very bad example, but a very clear example how the state bodies see this issue in practice. And in most of the cases, NHRIs are state bodies. So we have to follow all the rules, like financial procedures or other rules created for the governmental state bodies. So sometimes we have this kind of problems in practice also.
Oh, that's very interesting.
Yeah.
We have time for Radosh to ask a question.
Thank you so much for this important piece of the research, Colin. I'm wondering, do you have any views and did you have any findings regarding the independence of NHRIs? Because I'm wondering what happens when NHRIs are not truly independent. Because what happens in Serbia is that the democracy significantly dropped, and also the ombudsman came under the significant political influence by the party who has the majority in parliament and who has put him in place. So what happens is they designated ombudsman office to be the independent monitoring mechanism. But yeah, now the question is they are planning to revoke his A status, A license, right? So because the independence came in question. So I'm wondering, what are the prospects of such mechanism operating in truly independent manner?
Thanks, Radosh. Great question. And something that came up quite a bit in my research about what does it actually mean to be independent. So in terms of national human rights institutions, what marks them out as being independent is they have gone through the Global Alliance of National Human Rights Institutions accreditation process at the UN, which is supported by the OHCHR. But my difficulty with that process is that it's almost like a textbook analysis of the NHRI, where it looks at their legal structure and their funding. So unless there's been some changes that clearly impact on that, the fiscal independence or the political independence of an NHRI, it's difficult for them to raise concerns. And I think that process needs to be more participative and needs to scrutinize more closely what it means to be independent, because the one thing that came back over and over again whenever I was engaging with DPOs was that independence, there has to be a culture of independence within an NHRI and within its commissioners and chief commissioner for it to be effective as an independent body. So I'd like to see that accreditation process opening up so that civil society organizations and DPOs, where they have concerns, can raise those concerns through that process, and then they can be addressed by that UN-backed system.
Good. As we are just within our time, I suggest that we will take a 30-second, 1-minute break to give ourselves, and we'll see whether Rosemary is online. So Rosemary is online. So we're going to progress in the order that's on the program. We can just carry on with that. So we'll just take 1 minute and then we'll start again. It's entirely up to you. Yeah. So we'll do the same format. That works quite well. Well done, Colin.
So what stage are you at now?
Good. We'll make a start again. Hi, Rosemary. Great to see you. So we're going to move on to our second research project. Our second researcher, Han, and again, we'll ask Han to introduce herself and to introduce the emerging findings from her project for ideally not more than 10 minutes. And then we'll invite Rosemary to respond in whatever way she wants to, and then we'll open it up to the audience, and then we'll stop at past, and then we'll move on to the third one. So welcome, Han.
Thank you, Mark. Hello, so I'm Han, I'm ESR 15 from Faculty of Law of Maastricht University in the Netherlands. So I'm going to introduce some of my initial PhD study findings and love to hear your comments. My study is titled Collective Voice in the Global Arena, Interaction between European Organizations of Persons with Disabilities and the United Nations. So my PhD study is a multidisciplinary social legal study. I aim to examine the outcome and results of interactions between national organizations of persons with disabilities in 24 European countries, or I call them the European OPDs, and 3 UN human rights bodies or procedures with a view to monitoring the national implementation of the UN Convention on the Rights of Persons with Disabilities, or the UN CRPD. So my main research question is that whether, and if so, how European OPDs have successfully interacted with 3 UN bodies with a view to monitor the national implementation of human rights in alignment with the CRPD. So I hope to understand what international impact these organizations, OPDs have, and if such impact translated into domestic practice. But today, the initial findings I'd like to present focus on the result of examining European OPDs participation in the state reporting procedure under the UN CRPD committee. And my study attempts to understand if European OPDs have achieved an impact on the state reporting procedure. And so, as you can see in the PowerPoint present here, there's some research findings. So first, how are my research findings innovative? So I find that existing research mainly focused on the role of disability movement in national and international legislation making, especially during the drafting of the CRPD. However, there's only limited evidence and systematic research explained how European OPDs participation and contribution to the UN human rights system in the post-CRPD era, and whether such efforts lead to substantial changes among European countries. And in terms of European OPDs participation in the CRPD state reporting procedure, as I will explain later, my study revealed related and probably essential states obligations enshrined in the CRPD Article 4.3 with Article 33, and it reveals that these OPDs have influenced the result of state reporting and identify some stakeholders and factors that could promote or hinder the successful participation in state reporting process. So I list 5 key findings here. The first finding refers to the normative framework and the state party obligations defined in the CRPD Article 4.3 in conjunction with Article 33, provide, I believe, the foundation of OPD's effective participation in the state reporting procedure. Because together with the later interpretation of the CRPD committee, these 2 articles, when implemented fully, they ensure OPD's participation in the national implementation and monitoring mechanisms. But more importantly, these 2 articles further require states to support OPDs and ensure their independence, access to data, and authentic representation in the participation process, which are also crucial to OPD's involvement in the CRPD monitoring on the international level. So my second cluster of findings, as you can see from point 2 to 5, concern European OPD's interactions with the CRPD committee in state reporting and their broad impact. My study revealed that OPDs from most European states, especially the national umbrella OPDs or the national disability councils, have actively engaged in the state reporting procedure through shadow reporting, briefings, and other formal and informal advocacy activities with the support from OPDs from European and international level, mainly like European Disability Forum and International Disability Alliance. Their input, the national European OPD's input was valued, prioritized, and sometimes cited by the CRPD committee in official documents like list of issues and concluding observations, as I find in some cases. So on the other hand, several issues in the national disability movement and the UN reporting system emerged from my study. The last point, as you can see in my slide, I was newly added. It's not in the submission if you read the text in the booklet, but I added because I assume my respondent will find it interesting. So related to finding point 4, my study found that in a couple European states, they have more individual OPDs participated in the CRPD reporting procedures, mainly from shadow reporting rather than collectively when compared to other states, some other states. My empirical research showed that some individual OPDs decided to participate in the state reporting procedure in these countries as they considered the main national OPD coalition failed to include them or represent their interests. So hence the authentic representation issue I listed in the finding point. In addition, a large amount of OPDs may participate in the procedure due to the fragmentation in the national movement, which means that there's simply no correlation between OPDs can be formed for shadow reporting activities. This issue I found was very prominent in the UK's first review, as hundreds, if not thousands of documents were submitted to the CRPD committee, mostly the shadow reports. And secondly, my study also revealed potential issues relating to the state reporting procedure. As the supporting staff from the UN Human Rights High Commissioner Office and some of the committee members have been working on the limited resources, which might contribute to the fact that a considerable backlog in the state reviews and inadequate support provided to OPD's representative who attend the CRPD sessions. From literature review, I think this issue is probably not limited to the CRPD state reporting, but widely exists in the UN reporting system. So based on my findings, I think the most urgent change is needed for some European states to design or reform their system to allocate support and resource, especially funding, to OPDs without compromising their independence. I think special attention should be given to self-advocacy OPDs and OPDs working intersectional issues such as women and children with disabilities. As Professor Quinn's presentation this morning, he also mentioned like intersectionality is the future of our work. And another change I'd like to see, which resonate, I think, Colin's finding, is that I'd like to see the national human rights bodies in European states to unlock their potential in assisting OPD's capacity building in participating in UN mechanism to monitor the CRPD if they haven't done so. National human rights bodies among some European states, including the NHRIs and equality bodies, are often equipped with more stable resources and long experience in dealing with the UN system compared to OPDs, and their input is also valued by the CRPD committee, as they also often referred or cited in the official documents, as I found. And the last change I think is needed, but probably needs more time, is the reform in the UN to provide adequate resource to the CRPD committee to conduct their tasks. It's probably also necessary to keep mainstreaming disability in the UN system to promote the importance of accessibility and reasonable accommodations in all the UN, and most importantly, the CRPD sessions. So I believe my research can provide theoretical legal interpretation and a practical guidance to OPDs interested in participating in the CRPD state reporting, but looking for reasons, working methods, or potential allies to work with. I also think my research will benefit policymakers, legislators, national human rights bodies, UN human rights bodies, and other civil society actors who are keen on collaborating with OPDs in the national and international monitoring among EU member states, or seeking to build better partnership with these organizations. And lastly, personally, I'd love to work more with OPDs, national human rights bodies, and other stakeholders to identify further and appropriate supports for OPDs in a specific country context to ensure the implementation of Article 4.3 in conjunction of Article 33 of the CRPD, and to better facilitate OPD's participation in state reporting procedure and probably other interactions with human system in general, UN system in general. Thank you. That's my presentation.
Thank you, Han. So we now have the possibility, I think, to go over to Rosemary, if we're able to unmute Rosemary and bring her in. Hi, Rosemary. Great to see you. We can hear you now. It's great.
Okay. I could make some trite pop culture reference and say nobody puts Rosemary on mute, but I won't. Thank you very much, and thank you, Han, for your presentation. And I was really interested to read your summary and the scoping of your research. And I'm very much intrigued to discuss. I'm really intrigued to find out more about it, and it was good you were able to highlight that extra point in your slides that wasn't included in the booklet. I have a series of questions, but first of all, I will talk about the positives. I mean, you're quite right. This is of significant importance. I mean, the work of the treaty body systems is only underscored by the issues that civil society brings before it. States parties will bring what is requested of them in their state reporting process, but it's only through civil society that we are able to gather evidence of what states parties don't report. And that is an incredibly important element of the process of monitoring international human rights. I seem to have lost all Zoom.
We can hear you, Rosemary.
But you can still hear me? Okay, yeah. I can't see any of you or the shared screen, so I'll just keep carrying on regardless. What I would like to ask, and you raised this point, and it's typical of Gerard Quinn coming in early in the morning and stealing my thunder. You point to a legal, doctrinal and empirical research finding to indicate that the normative framework around states parties' obligation is defined in 4.3. I suppose what I want to ask about the doctrinal question is, how does that relate? If you look at the legal construction of the requirements of the obligations under 4.3 and 33.3, but you look at it within the entirety of the interpretive matrix of the convention, so looking at the purpose and the objective of the convention, how do you equate and how do you measure and how do you evaluate what the doctrinal evidence is for the obligation? So if we look at civil society structure in the way that it relates to the UN Committee as we see it today, it's very much made up of either organisations of diagnostic groups or umbrella organisations made up of diagnostic groups. Yet the convention in no way refers to diagnostic groups except for in 2 or 3 very, very limited situations, and they are very specific situations. The framework of the human rights model of disability that is established by the Convention very much speaks to the experience of impairment, not the diagnosis of impairment. So when we talk about diagnostic groups such as intellectual disability or psychosocial disability, or vision impaired people or hearing impaired people, we're talking about a diagnostic group. We are not talking about what the human rights issues are. CRPD is framed around the human rights issues. So my question is, how will your research address and evaluate the doctrinal framework or the legal construction of 4.3 and 33.3 and participation by civil society in the work of the committee? The other question that I have is, does that influence the framework in terms of the legal grounding of the PhD? So in what way do you see the process of human rights, the existence, the framework of international human rights as we have known and understood it for the last 60 years, what does that mean about civil society participation? And what does that mean in the context of Articles 4.3 and 33.3 and the engagement of civil society, and in particular, people with disabilities with the CRPD and with other committees? My other question that I wanted to raise is, what role does treaty body strengthening play in the analysis of the engagement of civil society, i.e. people with disabilities, with the committee processes? There's been an extensive review process happening within the United Nations over the last 20 years really, but the last 8 years in a focused way that is evaluating and proposing mechanisms by which to strengthen treaty body practice. To what extent is that process informing or critiquing? Are you critiquing that process in terms of the way in which people with disabilities can engage with the committee? Those three areas, I think, are critical areas that need to be answered before we can get a true assessment that can provide answers that raises questions about how civil society should be framed at the domestic level and at the international level, and how they can most meaningfully engage with the committee or the treaty body system as a whole. I raise these in terms of a bit like, as you indicated, Jared called it this morning, intersectionality is the future. But the only reason that intersectionality is the future is because I believe it is the nature of the CRPD. And we need to go back to that legal construction as a first pillar and structure everything around that. In terms of questions that are raised around engagement at the domestic level and how regional structures and domestic structures incorporate civil society engagement. If we come back to both 4.3, if we come back to 4.3 we can see elements of that set up a disconnect with what states see as the jurisprudence and the legal framework. How do you deal with and how do you argue the obligations on states in terms of the solid jurisprudence, what is seen as jurisprudence by states and what is seen as jurisprudence more broadly, i.e. general comments. And I'd be interested in yours or other people's thoughts on those issues.
That's great, Rosemary. Thanks a million. Lots of interesting questions there, both around the kind of legal foundation and interpretation, lots of things to think about, but also just about the capacity of the treaty mechanisms to be able to incorporate these things. And I think, I mean, look, also the wider question about representation, you know, how organizations are able to represent the collective voice of disabled people in an environment of intersectionality. And Rosemary raised this really interesting question about diagnostic groups and that being perhaps not an appropriate way to do it, but what are the appropriate mechanisms? So lots to think about. And I've given you 30 seconds of my talking to consider those. Sorry. Do you want to respond or do you want to take a question from the floor?
Yeah, I think I can respond.
Yeah, okay, so I'll let Han respond and then we'll see if we can take a question from the floor as well. Go.
Thank you, Rosemary. That's very interesting and challenging questions. I'm afraid I don't have answers to all of that, but they're very valuable input that helped me to work more on my next stage of analysis and drafting the thesis. I think I will address a couple of the questions you mentioned. I think you mentioned a question, the second question on the process of international human rights system and what does it mean for civil society in the context of Article 4.3 and Article 33. I think from my empirical research, I really find many OPDs in European countries, they take the international, the UN forum as a way for them to leverage their political impact on the national level, or as an outlet if they don't have any means to participate in national mechanisms. So for them, I think it's really important because their OPD representatives I interviewed, they just simply were not engaged in any national participation or consultation process. So for them, the UN mechanism is the only way they can engage and they can have their voice heard. So it's really important for them. So I think that's just to respond to that. And also respond a bit to the role of treaty bodies in how they engage with the civil societies. I think particular in the case of the CRPD committee, I think apart from the official review, including a closed session in each review, actually the CRPD committee, they use lots of their personal times, and there are lots of work that have been done informally between the CRPD member, especially the country rapporteur, when it comes to the country review, that they spend lots of time interact with OPDs and really try to listen to them and understand what's going on in the country. And I think even though that's not part of the official process, it's very important and meaningful for OPD's engagements when it comes to the state reporting process. I think I will stop here and maybe take some more questions. Thank you very much.
Great. So maybe we could take one or two questions or comments, contributions from the floor. Don't be shy. Teresa. And of course, Teresa, as a member of the committee, has been on the other side of this equation.
Hi, it's great to see you, Rosemary, and thank you, Han, for your exceptionally well done research on this important issue. We really need to understand how civil society, and especially OPDs or DPOs, how I call them, can work efficiently in order on the international level to get their voices heard and their human rights respected and implemented. I think you have raised so many important issues, and I wonder whether, especially the issue of intersectionality, as well as experiencing impairment as versus diagnosis of impairment, whether the answers to the questions in relation to these issues we can find in the general comment number 7 on participation, meaningful participation of disabled people according to Article 33.3. I think there is a lot of we can find a lot of answers, especially when it comes to who is a legitimate representative of people with disabilities. According to the committee's view, at least at that time when the general comment was adopted, as well as the importance of taking an intersectional approach. Thank you.
And sorry, we have a question at the back. Yeah.
Hiya, I'm Jonas. I work for Human Rights Watch. Thank you so much for presenting the study and the work. I have a very, I would say, practical question nowadays in times of COVID-19. I'm wondering to what extent you managed to look at in your work how the pandemic has maybe hindered or maybe even facilitated engagement with the CRPD committee, not only when it comes to engagement during the review process, but also the information that is provided in the shadow reports, for example, because maybe the information that we try to submit, is maybe not, sometimes challenged, and also not maybe the most updated because, we just face different challenges coming with the pandemic. So I'm wondering how that might have been reflected in the work or from your interviews and the experiences. And maybe also the question to the CRPD committee, to what extent maybe the pandemic has also led to an even greater reliance on civil society involvement, on civil society participation to actually know sort of the most pertinent issues when looking at a country and going into the country review. Thank you.
I think given the short time available and the topicality of that question, maybe you would like to just respond to that one?
Yeah, but because my research basically is done during the pandemic, so that's definitely a question or issue that the OPD representatives I interviewed raised. I think it brings some challenges and as well as opportunities. According to the answers I heard, for some OPDs, they really miss the opportunities to interact with the CRPD committee members in person. And they find that kind of informal conversation is really important for them. And for some people with disabilities, it's important they have the private conversation with the committee member for them to feel comfortable. But for some OPDs also I talked to, they actually welcome the fact that the review, for example, was mostly held online, because for them, the cost to Geneva is really huge and they just simply cannot go there. before. And now because the review is online, so they actually have the opportunities to engage in the review and talk to the country rapporteur. And also for some of them, they feel like it's actually less complicated for them for those who have been to Geneva but didn't really have a good experience, because considering how complicated it was and have to talk to people, etc. And you have a question about CRPD committee. I don't know if Rosemary want to respond a bit on that.
We have 1 minute available.
The COVID experience has definitely demonstrated exactly what Anna has just talked about, the fact that in some respects it's made it more difficult to be able to have what is a meaningful dialogue with states, but what it has done is it's opened up many opportunities for civil society to engage with the committee that weren't there before. So remote connection gave civil society participants that couldn't afford to come to Geneva the ability to be able to engage with Geneva. The problem is we keep a Eurocentric focus in terms of time zone, and that made it difficult for some civil society. The Asia Pacific was definitely locked out of that process, and so that was the downturn.
That's a great point, Rosemary. Yeah, that's one we were discussing just before we started. Yeah, excellent. Good, thank you so much. We're going to move on to our third research project now. George, so again, I'm going to let George introduce himself and introduce the findings, and then we'll come to Ruth and then come to the discussion. So we're just going to swap the screen displays slightly. George.
Thank you so much, Mark, and hello, everyone. So my name is Georges Meunier, and my research is on inclusion and participation of persons with disabilities in international development programs. And I'm looking specifically at programs that are funded by European Union and in Mozambique. So as my colleagues, I'm also applying a legal analysis, but also I'm gathering empirical data from persons with disabilities, but also other stakeholders that are involved in the implementation of those programs. So as you know, the EU is involved, supports several projects, several programs. So wouldn't be possible for me to look at all of those. So I just selected two. One of them is on social protection, which is implemented by local civil society organizations. And another one is on gender-based violence, which is a global project. And Mozambique is one of the countries that implements the project. So what I'm trying really to understand is what are the barriers and facilitators of participation of persons with disabilities in those programs, in one hand, but on the other hand is to also understand within the disability community, what are the groups, either empowerment types or groups such as women's disabilities and so on and so forth, that have more opportunities to participate and those that have less opportunities to participate. So today I have 5 findings that I would like to share with you. I'm still going through the data that I've gathered. So it's not all, this is just the minimum of that. So the first finding has to do with, so I found out that, well, we know for so many years now that poverty and disabilities are intrinsically related or connected. But poverty in particular affects the ability of persons with disabilities to participate. And even more to women, and I'm referring the ability of women with disabilities, but women without disability as well. So I'm talking about women without disabilities who have, let's say, children or someone to take care of with disabilities. So because of their material conditions, they are faced with very difficult decisions on whether to attend, let's say, a local meeting, a local community meeting, or participate in an activity of a particular project, and let's say to go to a market to sell products and be able to have something to eat in that day, or to go to the field to grow crops and so on and so forth. So those are very, or even, I mean, whether to go to the meetings or to take the children to school, you know, because sometimes they have to take them on the back, you know, to be able to and travel long distances, right, to go to school. So those are real and difficult decisions that they have made. And sometimes the decision whether to go to a particular meeting or not depends on the incentives that are available, you know. So is there, you know, some kind of payment, you know, that they will get by attending that meeting? Of course, not a payment to buy their participation, but let's say to be able to travel, you know, transport, and even to compensate for the fact that they didn't engage in local business or went to the field to be able to have food on the table that day. So those are some of the things that are part of the equation when it comes to the decision whether to participate or not. The second finding has to do with, well, what I call the value, the respect that the community have in relation to a particular person or a group. And a group, let's say a group of persons with disabilities or a particular person with disabilities. So that also affects the ability of persons with disabilities to participate in places where, for some reasons, they are respected, you know, they are valued, they have more chances, you know, to be able to have information about a particular meeting that takes place, or even to be nominated, you know, to participate in one of the forums, one of the projects that I'm looking at. They set up what they call social protection committees, right? So and people, to be able to be part of these committees, they are appointed, they are chosen based on, you know, the respect that the community has. So so this is very important, and often we find out that community, the society, you know, see persons with disabilities as less capable of performing or representing on particular issues. So that also keeps them outside of spaces of participation, and this may be really important for particular types of persons with disabilities. Let's say persons with psychosocial disabilities. There are more a lot of stigma associated with psychosocial disability than persons with, let's say, physical disabilities. They will still be, you know, indicated or nominated to participate in some of this. So in terms of at institutional level, you know, from looking at the decisions and the policies that are in place within the EU, but also in relation to external action programs, but also in Mozambique. What my research shows is that there's limited understanding of what I call the political economy of the civil society in general, but also of the disability movement. So what do I mean by that? You know, the fact that when we talk about civil society, sometimes we are talking about groups, you know, other rights groups, excluding persons with disabilities or the disability movement. So somehow disability movement is still marginalized from the mainstream civil society. So, and this is very important when you set up projects, development projects, and you engage local civil society to participate in the implementation. Because if you have that understanding, you will take additional steps to make sure that groups representing persons with disabilities are also part of the implementers, also part of the people leading the implementation of the project. The other finding has to do with that. I'm sure we all agree on this, which is a chronic issue. So what I found out is, well, although these projects have a particular commitment to leave no one behind, there's no data, neither monitoring system that enables them to capture, disaggregated data and process and make sense of that, of that data. So the ability to say how many persons with disabilities and which type of disabilities are participating, how many persons with disabilities are benefiting from these projects. It's not possible to say looking from the data that the project is gathering. I mean, they can present that on perhaps on other dimensions, women's, youth, and so on, but not on disability. They will just say, no, but we are working with persons with disability, but they will not be able to say more or less objectively to which extent. My last point has to do what I call, the limited understanding of what it means to be disability inclusive. So again, these projects have this commitment to leave no one behind, but I will just give an example on when it comes to gender-based violence. They have this commitment not to leave no one behind, to make sure that women's disabilities are included, but there's no reflection in there on how issues of gender-based violence affect particularly women's and girls with disabilities. And of course, this is also linked with other thing, which is lack of research on disability and on these particular areas, because some of that rationale is not in there because simply we don't know. We can do some proxy, but there's no research to back up, and some of these projects. So those are some of the findings I wanted to share. So I'll stop here. Thank you.
That's great. Thank you so much. And so just to welcome Ruth from the EU Cord Network, again, is really well suited to respond to this particular project.
Great. Hello, good afternoon. And I just want to thank you for actually picking a research project that looks at the international dimension and aspect of EU policy, because that's an area that I'm interested in. So it's great to have this opportunity to respond to your research project. Just by way of introduction, I work for a network called EU Cord, which is a network of European Christian relief and development organizations. But I'm also a board member of IDDC, which is the International Disability and Development Consortium. So that would be NGOs, networks, disabled people's organizations who are working in the field of international cooperation and humanitarian action, looking at the rights and implementation of the CRPD sort of within an international context. So I suppose that's my background and legitimacy for being here. I've been working in this field for about 20 years. So a mixture of I started working in the Caucasus, Central Asia, a little bit in Africa. And then the last 10 years has been more focused on being based in Brussels, working on advocacy and working with IDDC and EDF on implementation of the CRPD and an external dimension. And that's probably a good place to start because Jorge, you mentioned, I think one of the things you had in your summary was the fact that the EU sort of has its policy pledges and guidelines in place. And I think that's probably an important start, because I think at that level, we have a good framework and a good basis for the external action to be compliant and to be upholding rights, to have a rights-based approach and to be fully inclusive. So that's always the first step. And I think that's positive, although I think I was still disappointed that when we had the new instrument for the EU's external action, the Global Europe instrument, that we still had to advocate that the reference to the UN CRPD was present in that legislative framework at a high enough level so that it was going to cover the whole of the EU's external action. And I think maybe that sort of the other broad comment on how the EU works externally is that I would say maybe we have sort of the two broad modalities for how the work takes place. We have in a sense, you've looked at the elements which are slightly easier to track, and I don't mean that in a negative way, but actually, if we look at how sort of grants and sort of very, very specific projects are implemented through civil society, that we stand a chance of being able to review these and have a sense of things like how data collection is working and to what extent inclusion is happening. And the element which is much harder would be the funding that goes through things like the European investment banks and funding that goes directly to national governments, where we have less oversight on what happens with the big infrastructure projects, road building, large constructions. So to what extent those are going to be sort of compliant. And I think that's sort of too big a scope for your project. Perhaps that could be a future study for you to undertake. But I just wanted to put that on the table. Coming back to the sort of the points that you looked at, I'm not going to go into them all, but maybe just a few things that struck me. I was really interested in the discussion that we had from the first sort of early today about the dominant policy narratives, because I think that's quite pertinent in this case here, where I see that we have a context where we can say, yes, we have policy frameworks, and yes, in theory, we have tools, we have commitments, we have toolkits, but if we're not changing, or what do we understand, or what do we see to be at the EU level as the underlying policy narrative that we're actually trying to change, or what's the narrative that maybe is not true, that's being continued, that actually means that the policies, the frameworks, and these things which in theory should be giving us more disability inclusive development action aren't actually being implemented or being felt. And it'd be really interesting if you could maybe if you could include some reflection on that in your study as you continue the write-up. So maybe just checking my time. Okay, maybe just a sort of a few points. I thought that I think your point on poverty is really interesting, also because it's a word that actually we tend not to use anymore, because we talk a lot more about sort of inequalities and inequality gap. But I think it's interesting to come back to this word of poverty itself and the impacts of poverty and how that is affecting the decisions and the ability of people. And you use the word, you specifically looking at women in terms of how they participate and the issues of subsidies and incentives. I think as a practitioner, that's been very difficult for us, partly because I think that our donors, so in this case, the EU, tend to want us not to offer subsidies for people to participate in activities which they would see as being sort of community development, community related. And they would question us on things like sustainability and how are you going to build these issues of sustainability going forward. So I think having sort of more reflections of how of what you think that could look like and how that might work in practice would be very helpful. You also very correctly look at sort of the whole data monitoring issue. I was actually a bit depressed to hear that data wasn't being collected, because I think it signifies that if that level of data is not being collected in a project which is targeting social protection, then it means that even less data is being collected on inclusion of persons with disabilities in sort of, let's say, I won't say maybe more generic type of livelihoods projects or other types of projects. And maybe, and I think there it's probably the need to say, well, why, we can say, why is this data collection important? But obviously that why question still needs to be there. And so why is the data, why is it important? Why is it important to the people running the projects? Why is it important to the governments who then might sort of be looking at the policy recommendations or taking things on the project forward? And then to what level of data desegregation is needed? Because we're also looking at countries where many countries where data collection is already very difficult and not very easy for these sort of offices of statistics and others. So I think that getting that why message and is going to be important. I want to say a little bit in my remaining minute about intersectionality, because that's come up a few times, and you mentioned that in terms of women, and I think that there my reflection is that sort of in my experience we're not doing intersectionality very well. So we talk about it, and at the moment our idea of intersectionality as well will maybe go to a meeting that's run by maybe a women's group or a part of a women's network, and our approach is to say and disability, or we'll go to something to do with climate and then we'll say and disability. And so it's not, for me, my reflection is that we're not truly being intersectional. And I think it's sort of an interesting reflection on how do we do that in a deeper and in a more considered way, rather than it's just of a very tokenistic way. And then I'm just trying to also look at my notes. So yeah, and maybe sort of a question for you is sort of interesting to me, sort of who is the target for the PhD or for the target of recommendations. And I'm thinking about how do we actually drive real change, and where does that change happen? And I was speaking to someone yesterday. We've read a great book called 4,000 Weeks. So you should all read it. It's very good. And one of the things that the author says at the end of that book, he talks about we should maybe live without hope. And he says that hope can be a dangerous word, because if we have a hope, we have a belief that maybe that the government or the UN or the EU or somebody else can affect change. But actually, if we don't have hope, then what it drives us to do is to more take on that responsibility for being agents of change ourselves. And so I wonder that often when we write recommendations, we make recommendations for the other. So when I say other, I mean, I'm thinking for the EU, for the Commission. And we might have a few recommendations for civil society, but we kind of put them in there so the report looks a bit balanced. But I wonder that if we have recommendations which are then really targeting civil society, and I mean, if you're looking at these projects, I imagine it was the civil society actors that are implementing. It's the civil society actors are the ones that aren't putting in the data collection, or they're not the ones that are really sort of looking maybe seriously at this areas of intersection. So I'm being self-critical here. So maybe there's an element of how we maybe flip recommendations and yeah, maybe address how if we have no hope, then how would we actually take things forward for a different, maybe a more innovative way of trying to drive change. And I'll stop there.
Thank you.
Good, excellent. It's great to see this kind of critical dialogue with our researchers and the kind of confidence in which they're engaging with that. George, what would you like to do? Would you like to respond to any of those things? Would you like to take a question from the floor? Or it's up to
Yeah,
you?
I think I'll just address
Sure.
so that they don't forget some of the questions and comments. So thank you so much, Ruth, for this very important questions. So perhaps the first comment I wanted to address is on you know, the fact that the projects that I choose. So actually, that was one of the elements that I took into account, is to choose projects and programs that I can find with relatively easy information. So I wouldn't go for the projects, some of the ones that you mentioned, because that's really difficult. So in relation to so the issue of the narrative, the policy narrative, I really agree with you that you know, when you read the policies, the commitment is there. You know, there are even actions, you know, clear actions defined, although not at the level that we want. If we compare with other groups, let's say women's and so on and so forth, then the other question will be, this is the benchmark or not, but this is a discussion for other day. But still, it gives us, you know, some kind of reference. So the commitment is there. So what, in my view, I think there are two things. So one is to back up that policy narrative, the commitment, with really means. So make sure that delegations, EU delegations, and even at the Brussels level, there are people, you know, dedicated to that, to do this work. And in many countries, and in particular in Mozambique, you find out that the disability issues is often attached to the women's department or children's department. There's one. And there's no expertise. So the expertise there is for other things, women's and those other groups, but not disability. And they are honest on this. So when we talk with the delegations, right? So so this is one thing. And the other thing is, I guess I would say, policy coherence, perhaps. So you have now the new EU disability strategy, and around the same time, at least in Mozambique, they approved the new country program for the next 7 years. But there's a huge disconnect. You know, they of course talk about, you know, moving forward the agenda, the disability rights agenda, but you don't see this yet. When you read the disability strategy, the EU delegations are called to play a significant role on its implementation, and it's on external action dimension. So I think those two issues that you know, we have to have there to be able to back the policy, you know, commitment and narrative. On poverty, inequality, and you know, and the issues of participation. So this is a difficult one. So I talk about incentives, and I guess incentives can be anything. But I only think that's something we have to address. You know, this is a practical thing that prevents persons with disabilities to participate. You know, and this is, I'm not talking about people that they don't, you know, really engage and committed, you know, to do activism and so on. There are people that have been doing this for several years on voluntary basis. You know, they're not even professionals and so on and so forth. But these are the real issues, you know, that that really prevents their ability to participate. And if we want to talk about, you know, participation of women with disabilities, girls with disabilities, and so on, we really have to pay attention to this. So what incentives are those? That's, but I think we have to think about those incentives. So on that, I'm not sure if I understood well this question, but I guess one the more sophisticated kind of data, you know, the statistics, those collected by national office, statistic office. There's you know, they don't do it often. So in the case of Mozambique, they do it in 10 years. So the last one was in 2017. So the next one will be, I mean, 5 years or something like that. And we missed the opportunity of the previous one. So but that's important. But I think administrative data, you know, those collected at sectorial level in the education sector, you know, justice and so on and so, they're really important for day-to-day, you know, access to services and so on and so forth. Those are very important. So who are the target of my PhD? I mean, I guess they're, I mean, a bit of all of, you know, relevant stakeholders. One, I didn't say that, but the Spotlight initiative, which is one on gender-based violence, it's implemented by UN agencies. So those are the leading ones. And then they have local civil society doing the work. But it's the same story. Although there's a disability strategy, you know, that exists at the UN level, that oblige these agencies, you know, to make sure that there's a data disaggregated and so on and so forth. So it includes EU, the government, civil society as well. But most importantly is for those who have money, because they are the ones that most of the time dictate what actually is collected and what actually have to be reported. Yeah.
That's great, George. So fantastic, and just lovely to see this kind of critical dialogue and exchange between our researchers and the rapporteurs. So it's fantastic. We have used the time that was made available, and the time for the sign language interpreters we have used graciously. So, so just to conclude, so thanks to our three researchers for being really well organized, really well presented, and really clear. That's fantastic. And to our respondents for being so critical, and just for devoting the time to engage with our researchers in preparing for this and responding. It's fantastic. And I think there's a number of sort of common themes that come through that, the kind of barriers to participation for disabled people, whether that's at a level of a program or engaging with national institutions or engaging with international mechanisms, you know, and those barriers include access to resources and just that problem of representation. Who has the voice and the representation for disabled people in these debates, and how do we do that whilst also recognizing intersectionality? It's a real challenge. But the last point, I think, you know, who is this research directed to? You know, Jerry talked about change as being our key strategy. Where is the change? Who are the change makers? How do you communicate your recommendations from the research to those targeting those change makers? Thanks for that question, Ruth. I think that's a really good one. So thank you. That's the end of the session and time for lunch. Great. Thank you.